Okay, hi everyone. Welcome to Brain Talks. I'm Deborah Kan, founder of Being Patient. Well, we've been talking a lot about artificial intelligence and how it can help predict cognitive decline. Well, a new method in combination with MRI and assessing the shape of your hippocampus has proven that we can really predict decline up to 5 years before any symptoms are seen, or any major symptoms, I should say. Well, joining me today is Dr. Mallar Chakravarty. He is a computational neuroscientist at the Douglas Mental Health University Institute, joining us from Montreal, Canada. Dr. Chakravarty, thank you so much for joining us.
Thanks for having me.
So let's just start with the traditional method of assessing cognitive decline. When somebody really wants to know, do they have Alzheimer's, they traditionally could get a PET scan or a spinal tap. Most people don't do that, of course, because it's so expensive and not covered by insurance. But that's really the traditional means of understanding whether there's plaque or tangles in the brain. So my question to you is, how is machine learning changing this for us?
Well, I mean, even before that happens, if you want to know if you're at risk for Alzheimer's disease, many people who believe they are at risk will be going to their family doctor, for example, or a memory specialist to basically let them know that they're seeing changes in their cognition. For example, they can't remember appointments, they can't remember simple tasks and where they need to go on any given day, and they'll miss appointments and that kind of thing, right? So oftentimes in elderly populations, this is diagnosed first and foremost as geriatric depression, because these early signs in the elderly populations kind of share a lot of features of geriatric depression. So certainly what we see, in the studies that we've done and when we've done patient and subject recruitment, is a lot of them see their general practitioner, their family doctor for a long time as depression patients, and then slowly, after years have gone by, they realize that they indeed may have a memory impairment. So traditionally, what will happen first is most patients will undergo a battery of neuropsychological evaluations once they're kind of realizing that there is cognitive decline. And that doesn't guarantee you of having an Alzheimer's diagnosis. That just tells you that you're kind of below average on cognition, or taken over time, it could mean that your cognition is in decline. And so, it's only really after that, where there's some suspected dementia or Alzheimer's disease, that a doctor will prescribe a PET scan, or typically a PET scan, and in other cases a spinal tap to look for amyloid or tau in the blood. So, what we're trying to do is say, okay, well, what's really important is catching these people at the earliest stages of cognitive decline. And so what we've done is basically we've developed an algorithm that can take some simple metrics, so taking tests that are done in the clinic pretty routinely, taking one specific genetic variant called apolipoprotein or ApoE, which is what it's commonly known as, and then some MRI data, just structural, very run-of-the-mill MRI scan, and taking those data and feeding it into our algorithm and predicting, are you at high risk for decline and are you not?
So, I mean, that's actually, so are you targeting people with depression? I mean, with depression especially, it's kind of a chicken and an egg scenario, because we know through research that depression can actually speed up the road to dementia. And so when you want to predict before symptoms start, is it really just the APOE4 crowd, the people who are genetically predisposed to Alzheimer's, who you're targeting?
Sorry, you cut out there in that last.
No, is it really just the APOE4 crowd who you're targeting at this stage with your algorithm?
No. So the nice thing about these kind of algorithms is that they're not limited to just one specific bit of information. Really, they take a composite picture of what does the short-term change in brain anatomy look like based on MRI. Now, knowing that this person has ApoE, does that make their risk worse? And knowing that this is their brain signature and this is what their cognitive data look like, does that make a difference at all? So I think all those things together is what we're trying to find out. We're targeting really anyone who is elderly, who thinks they might have a risk, and that's really what we're interested in doing.
So the scan, the MRI scan, what is it? I mean, you know, we know for a PET scan, you can actually see by using a dye, you can see where the plaques and the tau tangles are. But I'm just wondering, you know, with an MRI, what is it actually that you're looking for? What can you see with an MRI?
With an MRI, you can get a really detailed analysis of brain anatomy. We know that neurodegeneration or brain atrophy is, plays a big role in kind of the path towards Alzheimer's disease. And that really is one of the, so we're kind of looking for signatures on the individual subject level, saying, okay, does kind of this anatomical profile fit into a set of other profiles that we've already learned about? And does it indicate that this individual is at risk for Alzheimer's disease? So
are we, give us an assessment about where we are with machine learning and predicting and diagnosis. I mean, it seems like a lot more people are getting into this space. We're going under the theory that it's a lot of different factors that you have to consider when assessing cognitive decline. Machine learning just helps us get that information faster and create a more comprehensive picture. So how far away are we from someone like myself, who's a healthy individual, but starting to feel like maybe, you know, my memory wasn't as good as it was in my 20s, from saying, okay, can you predict how quickly my cognition is declining, and what does that mean for the future?
So, I mean, I think there's a lot of parts to that question. One is, I guess the first part is how far is artificial intelligence from helping us make these types of predictions on a more routine, probably clinical basis. And I think, what we're seeing is, one, this incredible growth in technology that supports artificial intelligence. That's very, very important. The other part is that in terms of artificial intelligence, what we're learning is that, a lot of these algorithms, for example, were developed by a lot of the algorithms that we've been using. We've kind of readapted from algorithms used by companies like Google or Facebook, where they were initially implemented on, for facial recognition software, for example. And that, in a way, is somewhat easier to do because Google or Facebook has, the whole internet to draw from in order to do its training and its testing. So you have to remember that these algorithms will only learn what we tell them to learn. So they're only as good as the problem that we teach it to solve. And it won't learn anything more or anything less. So, in our cases, in terms of healthcare data, you're somewhat limited. You're limited by where the data comes from, how much data you have access to. And one very clear and big limitation is just kind of, different clinicians or different sites will have a very different name for the same thing. So how do you standardize all that across sites in order to train your algorithm? So I think that is going to be a really important thing to overcome in the future. So, I think these type of methods hold obviously a lot of promise, but I think we are a ways away from in the future.
Your audio is going just a little bit low for some reason.
Okay, is that better?
Yeah, now we can hear you. Okay, so tell us a little bit about when you say a combination of MRI and the shape of the hippocampus. What do we know about the shape of the hippocampus? Obviously, the hippocampus is the area of the brain that's responsible for memory. What do we know about the shape and predicting decline? And I assume something like machine learning could help with that.
Yeah, I mean, this kind of integrates across two different studies that we did a few years apart. So in this current study where we've been using machine learning, we actually didn't look at the shape of the hippocampus at all. But in previous studies that we've done, we've indicated that it seems that the shape of the hippocampus is actually, in individuals who otherwise aren't showing very much cognitive decline, is a really interesting biomarker, an interesting feature that we can use to help predict decline. And it might be more robust than more traditional markers like volume. And the reason for that is that the shape, at least as it appears on MRI, may be far more, maybe indicative of kind of earlier changes that don't show up as a volumetric change, indicating maybe rewiring with the rest of the brain and so on. So that is possibly one factor that we could also pursue in the future in combination with the MRI work that the artificial intelligence work that we do.
So, and we have a question coming in from a viewer who has said, my wife has suffered from anxiety and depression for years and died of FTD, that's frontal temporal lobal dementia. 16 months after diagnosis, she refused MRI and a CAT scan. Would this have, she died at 67 years old. Are you testing younger people for dementias like frontal temporal lobal dementia?
I mean, in my lab, we're not necessarily. I think people are. More and more, I think the dementia world in general has moved away from, and rightfully so, trying to cure the disease or treat the disease after we know it's there. Moreover, what people have really started looking into is primary prevention. So prevention at a stage where, people in their 50s or their 60s, where we know that risk is starting to go up in those people. So you could imagine, like you were mentioning before, the ApoE4 crowd, if they know that they're at higher risk, really targeting them, or targeting anyone, based on any set of metrics that you can imagine that appear to be at high risk, and trying to I guess reverse any or delay any disease that could potentially happen down the road.
So, artificial intelligence is relatively new, especially applied to this purpose. So my question is, how do you know that you can predict? Has it been around long enough to say, oh, these people did come down with Alzheimer's, or oh, they did go into significant decline? Where's the proof in all of this?
In terms of being able to...
In terms of, like, let's say artificial intelligence putting everything together identifies somebody as a higher risk candidate, and which is what you want. I get that we all want to know how big our risk is so that we could adjust other lifestyle and make health adjustments and lifestyle adjustments in order to kick the can down the road. But my question is, artificial intelligence hasn't been around for that long. So how do we know how accurate it actually is in identifying the right people who potentially have a greater risk?
So, in fact, artificial intelligence has been around for a very long time. The first, the granddaddies of this field, proposed these algorithms that we're using now almost 45 years ago. And at the time, they were kind of laughed out of computer science because people thought, oh, this will never work on a large scale. And it just turned out theoretically it worked, and what we were missing were the computers. So the theory and the backbone has been there for a long time. The proof is in the pudding in a lot of ways, at least in your day-to-day life. Self-driving cars, Netflix, Facebook, they've all shown that artificial intelligence can really do a good job of predicting behaviors and predicting preferences for individuals. So, what I would say is that there is proof, and it's very strong from different digital domains. They're in cancer research. Artificial intelligence is starting to make significant inroads because it's probably one of the biomedical fields where we've done a much better job in terms of precision medicine. In metabolic disorders, it's starting to happen too. So I think one of the main differences between those diseases in the brain is that we know a lot more about those disorders than we do about normative brain function and brain disorders. And I think those two things, as they come together and emerge together, will really pay dividends.
So we know that the algorithms get better with more data. So what do you hope for the future? I mean, what is it that we may know, let's say in 10 years down the road, that we don't know today?
Well, what we know already is remarkable compared to 10 years before in terms of neuroscience and clinical neuroscience and Alzheimer's disease as well. There's been a lot of changes in the way we approach Alzheimer's disease in the last 10 years. So in 10 years from now, I think we'll be making, in terms of where artificial intelligence will be, where modern medicine will be, and hopefully the confluence of the two, I think we have a long way to go. I mean, technologies like brain imaging, like genotyping, just regular genetics, and understanding lifestyle risk factors, like we were talking about before, like depression, like diet, like obesity, and how all those things come together. I think that's going to be where artificial intelligence will play a very, very significant role in the future. And it's a pretty exciting thing to think about.
Great. Thank you so much, Dr. Mallar Chakravarty, for joining us and sharing your research with us. It's really interesting to keep an eye on where and how artificial intelligence will help us to understand our cognition or its decline in the future. So thank you so much for your research and your time.
Yeah, thank you very much. Thanks for having me here.